government will make more impact if we actually work with communities, with civil society, and with non-government actors.
So collaborative efforts are very important because we are all based in one country and we have to work together, and where I am limited, the other person or the other organization will fill that gap.
In Namibia, we work with maternal health and child health, including nutrition. In our work, we support the Ministry of Health and Social Services, both at national and the regional level.
The origin of it was a discussion or conversation that we as an organization and a couple of partners, McKinsey and Presencing Institute, had with Gates Foundation. And they were interested in testing out a change management process in the health sector. Typically we would feel that the content knowledge sits in the system. They understand what they're doing, they have the technical ability to deliver, but somehow they've lost the ability to work as a team, and they've lost the ability to think and attack problems in a different way. And I think that's what we bring.
The first point is to sense your surrounding, your environment. Try to put yourself in the shoes of the people, for example, of the nurses that are working. You try to understand the system as the whole. To create that inner sense, or to create that knowledge of what is really happening before they can start to embark on a project.
And once we have data that we have collected, we bring it back to the team, to the innovation team that we have established. Then the team would then sort of look at what would be the best solution.
RDU stands for Regional Delivery Unit. This unit was strategically placed within the ministry to be able to deliver, to be able to quickly deliver the services, to be able to quickly to solve problems faster. Usually we have our own system in the ministry that might take time to get things done, or we might have some, because of the procedures and the channels that everybody has to follow. So this unit strategy is to try to cut on that procedure and to see how we can break that long process, and so that we can be able to be in position to solve problems quicker and faster way.
One of the areas where we started innovations is the area of providing quality services to the mothers and the children. And in doing that, we came up with the innovation of deploying containerized clinics. They are fairly quick to set up compared to when you have to go through the system of building a new clinic or renovating a new clinic. In cases where you put up a containerized clinic at an existing facility, you can even do it within a period of 3 months.
Or one of the reasons why people would not attend ANC at the further clinic was because of distance, because of the poverty state in which the people are living, and it was so necessary for us to put up a facility that serves the people that don't, and then they don't have to travel far distances, and in that way people are actually motivated to come to something that is closer to them, knowing that they are just a walking distance away.
People used to get to have babies at home. People used to rather stay away instead of attend antenatal care. Babies were not immunized fully because they don't want to take that chances to walk.
So it was a way of providing access, but also decongesting the clinic and reducing the waiting times, because with the containerized clinics, the mothers and the children can go straight to the clinic without having to sit in the queues with all other patients.
This is Kefas. Kefas is now 5 months old. He was born this year, January. He's now a big boy. So we take care of the mothers from the beginning of pregnancy. Antenatal care, postnatal care, family planning, until the baby starts go to school.